I know we had a beautiful weekend, and somehow or the other, we have to come back to work, and we have to come back to work in the rain. And then on top of that, some of you probably were on places like the Southfield Expressway and other places where it was really very difficult to get here. So we are delighted to have you join us. And I'm going to say again on behalf of the Pediatric Integrated Healthcare Work Group, that's a mouthful, welcome.
Welcome.
Okay. It's a delight to look around, and I'll tell you what I'm even more excited about is I look around, I don't see all the faces that I know. There are many of you that are new in the room, and that's really very exciting. Allow me just for a quick moment, I'd like to introduce myself. I have the distinct pleasure of serving as the co-chair for the Pediatric Integrated Healthcare Work Group. My name is Jametta Lilly. I'm also, and particularly blessed to be the project director for the Wayne Children's Healthcare Access Program, which is a newly funded, maybe not so new anymore, children's medical home improvement model. And also the chair of the Great Start Pediatric and Family Health Action Team. So those are some of the three hats that I'm spinning around. But now that I've introduced myself just a little bit, I think we want to pause and get a feel for who's joined us today, particularly as we see so many new people. What I'd first like to do is introduce you to the folks who are so essential for making this event happen before we even talk about why are we here. So I'd like for all the members of the Pediatric Integrated Healthcare Work Group for Wayne County, if you would kindly stand. Okay. And now that you're standing, how about I pick on you? If you would tell us your name, I'm going to start here with Fawn, and what hat you wear.
On Kern, parent rep for Wayne Chap.
Okay, thank you, Fawn. Thank you, Dorinda. Thank you, Chris. What hat do you wear, amongst many?
Today, Director of Child and Adolescent.
Okay, thank you. Thank you.
Carla Nichols, I'm the Director of Children's Services for Detroit Wayne County Community Mental Health Agency and the co-chair of the committee with Jametta.
Thank you so much, Carolyn.
Mary Mueller, I'm the manager of the social work department at Children's Hospital.
Thank you, Mary.
Marilyn Sanders, the clinical manager for the Children's Unit and New Center for Mental Health Services.
Thanks.
Lisa McFarley, Wayne County Health County Services Minister.
I'm Sally Torres, I'm the social worker with Wayne Chap.
Thank you, Sally. In the back of the room?
Roberta Walker, I'm with Southwest Counseling Solutions. I'm our Director of Program Development.
Thank you, Roberta. And last but certainly not least,
Jen Dr. Check, Connections, Access Coordinator was my previous job, but I'm sorry, Services.
okay, thank you so much. There are others standing who are part of another very special group that you'll meet shortly. Let me tell you a little bit about today, and I'm not sure where some of you folks are from. How many of you are in mental health in some capacity, work in a community mental health agency? Can we see your hands? Great. How many of you work with a Department of Human Services in any capacity, foster care, CPS? Hands up. Wonderful. It's really wonderful to have you in the house. And how many of you are educators working either in early care and learning or either in K through 12? Okay. How many of you are involved with any kind of systems change or collaboratives, like Great Start Collaborative Wayne? Yes. Okay, let's see all the hands for Great Start Collaborative Wayne. And do we have anyone here that is either a nurse, a practitioner of any sort in physical health care? Okay, wonderful. So anybody here from the faith-based community? How many parents do we have in the room who are specifically parent reps? Let's give them a hand. Well, that's very important for us to have a feel for who is here today, because as you can see on the PowerPoint, we are trying to be a vehicle to bring people together in physical and mental health, child welfare programs, and school systems. Because the reality is, when it comes to serving our children, there's no such thing as just one compartment in which we can respond to them. We need to be able to do what we call, in so much of our Wayne Chap, let's connect. And let's connect the mind and the body. Because this is how we really end up doing it to people. we say come into the doctor's office and get your services here, right? And then if you need mental health, you're supposed to go over there. And I see heads nodding. And the reality is that's part of the fragmentation that exists in our system. So as a result of understanding that we have people who are responding, they believe to the mind and believing to the body, but the reality is that we really aren't doing a very good job if we separate those two. So accordingly, the Pediatric Integrated Healthcare Work Group was born, really, and I have to thank again Carla Nichols, the Director for Children's Services at Wayne County Mental Health Agency, because she knew all the time the same thing that certainly we knew with CHAP, is that it is systems fragmentation that in many ways helping and pushing our children into cracks, and they are not able to develop and be nurtured in the way that we need. And it's not just an issue what's going on in the community and families, it providers is the way that we work or don't work with each other. So we came together to say, well, it doesn't matter whether or not you're human services, it doesn't matter if you're healthcare, it doesn't matter if you're an association, it doesn't matter if you're the schools. Guess what? All of our systems are a little messed up. So it's within that context that we have come together and are working. And so as you'll see today in our materials and through these great skits that we have, what we are advocating to all of you here, and we know that many of you already embrace that, is that we need to have programming and responsiveness to the whole child. That we're looking at that child in terms of their cognitive development, their social emotional development, or some people call mental health, as well as their physical development. And we can't keep separating them out, because as a result of that, we've been able to see the problem. So some of the things that we advocate with Great Start, which is a system of looking at services for children pre-birth to age 8, is this whole notion of being responsive developmentally to that whole child. I want to just make sure we get on the same page just a little bit before we move into our great skits today. And that is, how many of you ever heard of pediatric integrated healthcare before today? Can I see the hands? Those of you who are familiar? Okay. Well, this is really important, and I'm pleased to look out and see that some people hadn't, because this event means that we are doing exactly what our intention was. This is the first event being held by the Pediatric Integrated Healthcare Work Group to build awareness, to hopefully advocate to people how important it is that we now begin to be aware that there are best practices, there are program models, there are specific strategies and ways that we can work with parents and ways that we can bust down some of the silos that separate us and improve the quality, the access, and the care. So that's what integrated healthcare is about. It's the notion that physical and behavioral health problems often occur at the same time. So often what goes on with us, if you have a headache, it's going to affect you somewhere else in your body. If you are a young child and you have asthma, then we automatically know in that school system that's the #1 reason for school absenteeism. If that's the #1 reason for school absenteeism and that child is not in that school setting, well, we know that's going to impact their school performance. So the notion of pediatrics, or children's integrated healthcare, is to bring specifically mental health providers, and when I say mental health, I mean all the way from prevention through to acute care, bring our physical health community together, and that means physicians, it means nurses, it means also bringing together early care and learning folks. Yes, those mom and pop child care centers, those wonderful women and men who take care of children in their basement, grandmamas, uncles, bringing people to better understand developmentally how we need to be responsive to children. So if that's what pediatric integrated healthcare is, why? Okay. I just want to give you a few quick things, and we'll have these materials that you can look at more in depth. But we already know if a child isn't well and a child isn't emotionally ready for school, they're not going to do too well, right? But somehow we've got to make sure we connect that dot, because we can't keep saying that school readiness is just literacy. School readiness is being physically, to feel safe, to feel loved, to be emotionally ready. The other thing is that we want you to know is that in many cases, people with common medical disorders also have high rates of behavioral health issues. And this applies to not just adults, but also to children. Children who are experiencing physical health problems often have a whole series of social and emotional barriers and difficulties that they carry with them and then impede their progress. There's something else. You see that little purple dot up there? It says, now is the time. As Carlin would tell you, and anyone particularly working in mental health, and systems change, now is the time. We have the attention. Finally, we have an administration that is pro-prevention, that is pro-integrated care, so we have an opportunity, even as most recently Governor Snyder in his address on health reminded and said to us that it's going to take community programs working together, that we need to support patient-centered, or we like to say, family-centered medical homes, and we need to advance integrated healthcare. So what's going to happen with this group? This is our very first activity of our PIHW. We're building awareness. What we do today with you is that we're going to have 3 skits. And what those skits are the opportunity for us to experience a little bit of what we kind of call community theater. I can tell you right now, these skits are not going to be the Jerry Springer Show. Nope. Okay. We're not going to get really way out there. But what we've attempted to do is to provide some provocative information, and we want you to think about them in 2 different ways. After that skit, we're going to debrief it. We're going to talk for another 10 to 15 minutes about what did you see? What are the family issues and concerns or barriers? What are the programmatic or systems issues and barriers? And to help me with this conversation is someone that many of you know, a profound advocate for children, none other than Jack Kresnak, CEO of Michigan's Children. Hey, Jack. And it's really important that Jack is here because you saw that slide that I made that comment about the governor. So guess what? Folks, you have an opportunity. After each one of these skits, we're going to debrief them. And some of our wonderful professionals, both in community mental health, physical health, and human services, will, kind of help make some comments as well. But what we'll do at the end of our day is we'll take your comments and your input, and it's our goal then to come up with some recommendations that our pediatric and integrated healthcare work group can begin to put together to share both with Michigan's Children, who is the advocate for so much of the systems change that we're talking about, engaging legislators, engaging the governor's office, etc. Then we will also take that same information. Wayne County Mental Health Agency will look at that. Wayne Children's Healthcare Access Program that is about improving access and quality for Children's Hospital, federally qualified health centers, and others, working with our Great Start. We'll put those things together so that your input helps us move our agenda to say simply, we must come together to be responsive to the whole child. So with that, it's really time for me just to step aside, because now we're going to treat you to something a little bit different. And in the interest of time, I'm going to ask, there were 2 other people who are going to make comments. We're going to go straight into the skits. And then we're going to hit pause and say, what did you experience? Now, these skits that you're seeing, and maybe our players can kind of almost get ready, just kind of get, as they say, waiting in the wings. I'm really going back to my old performing arts days, right? We used to say waiting in the rings, upstage left, upstage right, are this wonderful group of people that I just really excited to say not only are part of our Pediatric Integrated Healthcare Work Group, but they're our team for the Wayne Children's Healthcare Access Program. And they jumped in full force with energy, creativity to help us take this idea and figure out how can we present it to you in a way that we make it real about what's the real deal when we talk about pediatric integrated healthcare. It's a big word, but let's break it down. Take it away.
Morning, Sally.
Hey, good morning, Frank. How are you?
Good. Doing great. Had a great weekend. How about yours?
Good
morning, Sally.
Hi, Kwame. How
Good
are
morning,
you?
Frank.
Hey, good morning. How you doing?
How you doing?
Good,
How was
good.
your weekend?
Good.
Oh, crap.
Hey, good morning.
How's it going?
Good, good.
Oh, who's
Got you
good?
a triple shot espresso, your favorite.
You
know what?
Favorite.
This is not a good way to start off a Monday.
What are you talking about?